Good afternoon, all, and thank you so much for joining us at our open house live sessions. We're so excited you're here today. We have a lot of great information to share with you. My name is Shannon Oliver, and I am the manager for School Partnerships and Outreach at the Lone Star College-Montgomery campus, and I will be your moderator today as we hear from our incredible panelists. So we're hosting a total of 5 open house live sessions this week. Today's session will be focused on health occupations and science information. So if that's what you came for, you're in the right place. But we had 2 sessions yesterday. In case you missed them, you can go watch them through our open house live website. You can watch on student services and transfer and career selection. And then later this week, we will have sessions focused on energy manufacturing and construction trades, and another focused on human services, fire science, professional pilot, and our digital and computer information technology programs. So be sure to tune into those as well if that sounds interesting to you. Just a quick reminder, our campus is currently closed, but that does not mean that we are not here to serve you. There are a number of ways that you can reach us to get assistance. We have the Virtual Mac Assistance Center, and that is available Monday through Saturday from 10 a.m. to 2 p.m. And it's staffed with admissions, financial aid, and advising representatives that you can speak with via a WebEx session, very much like we're doing here today, to get you one-on-one and personalized help. We also have live chat options that you can access through your My Lone Star account. And of course, our call center and departmental emails are always available to you. You can find all of this contact information on the link on this page. It's lonestar.edu/Montgomery-resources. So registration is open for the summer and for fall right now. So make sure that you register as soon as possible so you can get the classes before they fill up. Okay, so today we have some incredible presentations lined up for you to learn all about our health, occupation, and science programs. As you're listening to our panelists talk today and you have a question, please feel free to use the Q&A on your WebEx to ask questions, and we will address those at the end of the session. Just make sure you stick around. Today we have presenters from our RN program, our BSN program, our EMT program, our physical therapy assistant program, our medical radiologic technology program, and biotechnology. So we've got a jam-packed schedule for you today. So without further ado, let's go ahead and get started with our first presenter, Michelle Hopper, Interim Director of Nursing. Michelle, go ahead and kick us off.
All right, thank you so much, Shannon. I am, as I said, as Shannon said, my name is Michelle Hopper. I'm the Interim Director of Nursing Programs for Lone Star Montgomery. And as many of you know, nursing is a caring / helper profession. It's been around for the last couple hundred years. Professional nursing got started in the 1800s with Florence Nightingale and what she did in the Crimean War. Nurses, the goal of nursing is to protect health, to promote health, to improve health for people of all ages. Nurses use critical thinking and clinical judgment in the course of what they do every day. And right now in the United States, there's about 3.5 million nurses, which means there's about 1 in 100 people in the U.S. is a nurse. We actually have a projected need for about 250,000 nurses per year for the next 5 years to be able to meet the healthcare needs of the United States. So we need a really lot of nurses. We need you. The nice thing about nursing is that nurses are always employed. You are never going to be unemployed unless you just absolutely choose to be. I know nurses who have been nurses for 50 years and they've been continuously employed for that entire 50 years. And so if you're looking for something that's got job security, this is it. The other thing about nursing is that you are never, ever going to be bored unless you want to be. There are so many different kinds of nursing to get into. Nurses are researchers, nurses are scientists, nurses are informaticists. There are areas of nursing. You could be a cruise ship nurse, you could be a camp nurse, you could do forensics, you could be a nurse executive. You could go on for an advanced degree and become a nurse practitioner, or you could get a doctorate in nursing. So there's a wide range of things that you can do in nursing and lots of available opportunity for you. So in general, Lone Star College has, the system has 5 nursing programs, one here at Montgomery, Tomball, Kingwood, Cy-Fair, and North Harris. The admission dates vary for all of the campuses. So for instance, our application process for the fall has completed for Montgomery and Tomball and North Harris, and we are still accepting applications for the January start at Kingwood and Cy-Fair. And the link to the application deadline is on the PowerPoint here. So as far as general information, we highly recommend that you watch an online information session prior to application. One of our wonderful counselors at Lone Star Montgomery, Amy Robertson, did a YouTube video that gives a lot of information on what the prerequisites are and what you should have whenever you apply to the program. So I highly recommend that you watch that information session. We have two different career paths for nursing at Lone Star Montgomery. We have our licensed vocational nursing program. Vocational nurses provide a very wide variety of essential patient care under the supervision of a registered nurse or a physician. And these graduates are eligible for licensing as an LVN, and they pursue careers at hospitals, long-term care facilities, clinics, and other types of healthcare facilities. We also have our associate degree nursing program, and when you graduate from this program, you will receive an RN. This program is one of our most in demand, and it has very high growth career tracks in the industry. These graduates are eligible to sit for the RN exam, and they provide and coordinate care for patients in a lot of different healthcare settings. So we have two options for our ADN program here at Montgomery. Students who already have their LVN license or their paramedic license can enter into our transition program, which is designed to transition you over into professional RN. And then we also have our basic track nursing program. That's a 2-year program designed for students with no previous nursing or paramedic education. And here are our requirements. Now, they look complicated, but it's really not. You have to have math. You have to complete Math 0309 or 0310 with a grade of C or higher. You have to have a college level math class with a grade of C or higher. You have to complete the TSI math exam and earn a score of 350 or higher, or just submit some scores from standardized testing. If you have transcripts from other colleges, those need to be submitted for evaluation, and they take about 2 to 3 weeks to process. So the earlier you submit them, the better. You have to have biology. And biology 2401 is A&P1, 2402 is A&P2. So you have to have both of those for the LVN program, or one of A&P1 for the ADN program. You have to have English 1301 for the RN program. And you have to have a GPA of 2.0 or higher for the LVN, 2.7 or higher for the ADN. You have to complete the HESI A2 entrance exams. You have to have hepatitis B immunization, a criminal background check, and for the transition students who already have an LVN or paramedic license, you have to have a pharmacology course that is no older than 5 years. So all of these requirements are on our nursing program's webpage. They're all lined out there for you. And you're certainly welcome to email me and ask any questions about the requirements if you have more questions. So again, I am Michelle Hopper, and there is our Lone Star Montgomery Nursing Department email address where you can get more information. There's my email address, and you are certainly welcome to contact me. I am always interested in talking about nursing with people. I've been a nurse for 25 years, and I've always been employed, never been bored, and this is something that I love to do. So if you want to talk about nursing, I'm your gal. So thank you.
Thank you so much, Michelle. What is one piece of advice that you would give to a new applicant that would help them, or something they would want to know?
Well, actually, I have two pieces of advice. First of all, to be a nurse, you have to be dedicated and you have to be focused. And those are the two things that I think I would make sure that I am when I apply to this program. It's not the easiest thing ever, but if you're dedicated, if you're motivated, if you're focused, you will definitely get through this. The other thing that I would make sure that I do is check our webpage and look at our prerequisites and make sure that you have all of those lined out. We receive over 700 applications every application cycle. And so the ones that aren't completed are the ones that don't get looked at. And so that would be the other thing that I would make sure that I did.
Perfect. All right, thank you so much. All right, next up we have Dr. Brandy Crawford. She is the Executive Director of the RN to BSN program. So Dr. Crawford, welcome to the session.
Hi, everybody. Thanks for having me on here. Tagging on to what Michelle was just talking about the ADN and becoming an RN. Our BSN program, our bachelor's program, is one of the 3 new programs that Lone Star is starting as far as bachelor's degrees in the fall. We're in the process of looking and at our first 30 applicants, so we're very excited about it. So what's the difference between the BSN and the ADN degree? So BSN, the bachelor's, is everything that Michelle talked about as far as being a nurse. You get to do all those things, but maybe you're interested in becoming a charge nurse or becoming a nurse manager. Maybe you want to go back to school and become a nurse practitioner, or possibly you want to be a nurse anesthetist. So all of those you would need to get your bachelor's degree first. So this is the BSN program. It is a 1-year program that will be, it's more like an RN to BSN program. So after you've gotten your associate's degree and achieved your RN license, then you would be eligible for our bachelor or BSN program. So for the year, we focus on courses that will really advance you as a nurse, looking at leadership and management skills. We will also do a lot of classes about research, looking at evidence-based practice. You will also be in the community, working at community facilities and doing practicum hours with community and population health. So those are the things that we focus on for the BSN program for that year. Looking at admissions requirements, so this is one of the big things, like I mentioned before, you have to have your associate's degree and it has to be in nursing. You already have to have your RN license before being eligible to be in our program. Another big thing is completion of the Texas core curriculum and the course Psychology 2314. And grade point average, we look at a GPA of 2.25 for your classes associated with your nursing degree. On the next slide, I have the Texas core requirements. I know this is really busy, and not that you have to learn all these, but what I did want to mention with this is there are a number of classes that you have to take to be eligible that you don't necessarily have with the ADN nursing degree. So government, histories, you have to have at least a college level math and above. So I put all these on here just so when you get ready or thinking about it, you can meet with an advisor and be ready to take these classes, either while you're waiting to get into your ADN nursing degree or possibly while you're taking your classes for your ADN. That way you'll be ready to apply for the 1-year program. So I just have these listed up here just so you know there are many more classes, 32 hours that you'll need to have, as well as that associate degree nursing program or associate degree nursing degree. That's about it for mine. Like I said, it's new, it's upcoming. I do have my contact information, my email, also my administrative assistant. You're welcome to get with any advisor for core classes, as well as email one of us for any information. I also have on there the website that we have information specifically about the program if you have any questions. So thanks.
Thank you, Dr. Crawford. So one follow-up question I have for you is, you mentioned that you have to have your RN before you can get into the program. What type of time commitment does this program have? Would somebody be able to work as an RN while they're going through the BSN program?
Yes, so our program is 11 courses throughout the year, and we offer them in the evening, and they are hybrid. So you would be able to work your shift work as a nurse and still be eligible for the program. Most of the students that we are accepting are all working as nurses while they will be working in our program.
Perfect. Okay, and you mentioned briefly also the difference between the RN and the BSN and kind of what job types you could get. Is there any other advantages that students may need to know about why they would want to continue on
Right.
to BSN?
Well, being here in the Houston area, I'm sure everybody's familiar with the large hospitals, Methodist, Memorial Hermann. So a lot of those larger acute facilities, they're looking for an entry-level bachelor's degree nurse. So, um, so it is wise to get that degree if you're looking to work at one of those larger facilities in our Houston area. So
Perfect. All right. Thank you so much, Dr. Crawford. All
thank
right. So next up we have Dr. Kelly Weller. She is the director of our EMS program at the LSU Montgomery campus. Dr. Weller, thank you so much for being here.
Thanks so much for having me. Welcome, everybody. I'm excited to get to talk about EMT and paramedic. So one of the things that you have to understand going forward is EMT is a one-semester course. Paramedic is on top of that one semester. So paramedics we all started by taking the EMT course first. So that's a really fun, exciting thing. One of the things that I like about it is that it means that you can try EMT and you might decide that it's not for you, and that's okay too. So it's a good way to get into healthcare and get a job in just one semester. So in order to get into an EMT class, there are no actual academic requirements. You don't need English or biology or any of those classes. You do have to be able to pass a background check and a drug screen. You also will have to have American Heart Association CPR for the healthcare provider, and we do require proof of immunizations. So those are all requirements in order to sign up for the EMT class. So all paramedics start by taking an EMT class, and it's 6 credit hours. 5 of those hours is your lecture and your lab, and then 1 hour is actual field experience, where we put you on an ambulance with a working crew, and you get to see what it's really like. Sometimes we do a little bit of simulated hospital experiences as well, so that you can see what that is like. Our lecture for our classes is done via WebEx, just like this, or similar to this. And then our lab is face-to-face, and it teaches you all of the skills. So before you sign up for the class, you get a full schedule, and so you'll know exactly when you're expected to be in lecture and when you're expected to be in lab. So the paramedic is, I always have to smile when I look at that picture. She's amazing. The paramedic is 4 additional semesters. It is pretty intense. It takes a lot to learn how to save lives at that level. It does culminate with an ambulance internship at one of our local agencies. We use everyone in the local Montgomery area. The students are eligible to take their National Registry of EMT at the paramedic level, and we are an accredited, fully accredited program through KHEP and COA, and so we have a lot of very high standards for our students, but they come out of school and they get some really exceptional jobs. So if you want more information, you can contact me and I can connect you. We have information sessions that are live via WebEx about every 2 weeks with one of our faculty who spends some time going through all the immunizations with you and explains it all, how to apply for the college and how to get into the program, how to do your background check and drug screen. He goes through all of that with you. So you can contact me by my email or also by going to our webpage and clicking on the links there and send us an email.
Perfect. Thank you, Dr. Weller. So I'm going to ask you the same question as I asked some of the others. What is one piece of advice you would give to a new applicant?
So for the EMT program, we don't really take applicants. It's first come, first serve. So it's filled until open. For our paramedic applicants, we are a highly competitive program, getting quite a few more applications than what we can take. So things that you need to look at is if you've had A&P prior to starting the paramedic, that's a big plus. If you've taken the English and the psychology towards your associate degree in EMS, that's also a big plus for us.
Okay. And can you explain just the difference in the job types and job opportunities for somebody in the EMT versus somebody who's completed the paramedic program?
Sure. So EMT is entry level, and they come in with skill sets like taking vital signs, assessing patients, stopping the bleeding, that kind of thing. Paramedics, on the other hand, give drugs. They defibrillate. We use a cardiac monitor. It's very exciting, just like on TV, kind of. But we get to do all of those skills as a paramedic. In either case, you work under a medical director who advises you, but paramedics have much more autonomy. They also make a whole lot more money. Paramedics are making really pretty good money right now, and there's tons of jobs available.
Okay. Since this is a very specific field, it takes a very specific type of person who wants to do this. What are some characteristics of somebody who might be successful in this?
So great paramedics are people who have a caring personality, of course. I mean, you have to start with that. But also, everything is different every day. So one call is going to be completely different from another call. If you are fearless and you're not afraid to walk into somebody's house, take charge of a situation, and then your next call might be dealing with a baby. So we're going to deal with all age ranges, all situations, and every day is very different from the day before.
Perfect. All right. Thank you so much for the information.
You're so welcome.
All right. Next up, we're pleased to have Renee Pruitt. She's our department chair for the PTA program. Renee, please take it away.
I have it. Hi. Welcome to Lone Star College-Montgomery's Health Occupations program. How exciting that you're here, and I'm so glad you're starting this journey, hopefully, with us. The program that I work with most closely is the Physical Therapist Assistant Program, and I am a doctorate of physical therapy. So I wanted to start out this session by kind of explaining what physical therapist assistants and physical therapists do, because it can be quite confusing when there are two professions that operate under the umbrella of physical therapy. A physical therapist and a physical therapist assistant are licensed professionals that treat musculoskeletal or things that happen with your bones and muscles, and we do a lot of exercise to individuals with things like strokes, and I have a slide in just a minute. Don't change yet. I have a slide in just a minute that will go over some of those things. But there are two ways to enter this profession. One is the physical therapist that's a doctorate degree, and you can begin that here at Lone Star College-Montgomery. You won't finish here, but you will begin it here, and you will begin by taking your science curriculum, chemistry, biology, physics, statistics or calculus, and some psychology. You'll finish your AS degree and then transfer to a bachelor's degree program, and then eventually apply for a doctorate of physical therapy. The entire process takes about 8 years after graduation, but you shouldn't let it scare you. You can start off as a physical therapist assistant, which is what we work with here on our campus. The physical therapist assistant degree is an AAS degree. It is a workforce degree. It is competitive admissions, and we typically accept 30 students each year. After graduation, you're eligible to take a national board and apply for licensure as a physical therapist assistant. Okay. So go ahead and go to the next slide. All right. So what is a PTA if it's not a doctorate of physical therapy? Well, the PTA is the assistant to the physical therapist. They work as part of the team between the physical therapist and the physical therapist assistant, and they implement selected components of intervention. Think like 80% of the time, the physical therapist is probably doing paperwork, evaluation, assessments. The physical therapist assistant gets to spend 100% of their day treating patients. So the physical therapist assistant works with patients or clients very closely one-on-one. Different from nursing and EMS, we actually work more as coaches and facilitators to achieve the patient's own goals. The PTA would assist with that treatment all the way, just like EMS and nursing, from newborns all the way through the death and dying process or in hospice programs. We would simply treat those disorders that have to do with movement. So if you want to work with people that want to get up and walk, become a physical therapist assistant. I promise you, you'll spend 100% of your time in that area. Next slide. All right, so how do you become one? Well, the admission process is competitive. Students are required to take 4 prerequisites prior to applying to the program. If you are still in high school and a junior or senior, please take these as dual credit courses if they're offered at your school. Right after you graduate, you can apply for admission into our program, just so long as these 4 prerequisites are taken. The first one is English, and that's a freshman English. The second one is anatomy and physiology with lab. The third one is a psychology, and it's a general psychology. The fourth one is that intro to physical therapy. Like EMS, it is a single semester course, but unlike EMS, you don't get a certificate afterwards. It just tells you whether or not it's a field that you would like to become involved in. Then you would also do 40 hours of observation under a PT or PTA, so you would actually observe them doing what you want to do and see if you like it. You would need to do an application test, and then once you are admitted to the program, we would need background checks and drug screens, immunizations, and CPR. So make sure that when you're making your decisions as you move forward, you're making good decisions, so nothing shows up on those drug screens or background checks. Finally, I'd like you to connect with us. I am the department chair. There is our website. Please go onto our website. Like all the other health occupations, we have an information session that you may attend. If you go to the website, we have one that is pre-recorded, or join us every third Thursday of the month, and you can work with me and an advisor and our coordinator in health occupations to get you started in this career. I hope you have a wonderful time here at Lone Star College-Montgomery, and I hope some of you come and visit me.
Perfect. Thank you so much, Renee. Okay, so I'm going to ask the same question as I asked the others. What is one piece of advice that you would offer somebody who is applying to the PTA program?
I would advise you to spend some time in your books. Try to achieve that A and B. It is a competitive program, and you can't even get your foot in the door unless you are academically prepared. All of the slides underneath you look like loads of fun, and I always say that I go to work and play every day when I'm treating patients. But academically, you need to be pretty strong. And the second thing is you really need to you don't have to be introverted and you don't have to be extroverted. What you have to be is a relationship-oriented person. You have to like people.
Perfect. That was my next question: is what are some important skills and characteristics for somebody here? So you have to like working with people. Is there anything else you want people to know?
So according to and so I'm glad that my other health occupations chairs are muted at this point. But according to the Wall Street Journal, physical therapy is the third most satisfied profession in the United States. Ministers are first, firefighters are second, and third is physical therapists. So just a little thing, you have to really be interested in working with people. And once you do, I think the statistics prove we're pretty satisfied.
Awesome. Thank you so much for that information.
Thanks for inviting me.
Yeah, absolutely. Okay, so next up we have Dr. Francis Ozor. He is the director of our Radiology Technology program. So Dr. Ozor, please tell us everything we need to know.
Hello. My name is Dr. Francis Ozor. I'm the program director, and I'm going to give you a brief overview of Radiologic Technology. On our website, we have an online information section which has a complete overview of our program and the admission process. So briefly, I'm going to give you a brief historical overview, talk about our program, and then the skills you need, admission requirements, application process, employment opportunities after you graduate, and then career mobility, other things you can get into. And then I will talk about the advanced modality, advanced area we have here at Montgomery. So briefly, X-ray was discovered November 8, 1895 in Germany at a university called Wolfsburg University. And you can see the guy at the top with the big old beard. He's the one that discovered X-ray, Wilhelm Röntgen. And below that image, you have the first X-ray ever taken around 1895. That's his wife's hand. And you can see she's wearing a ring, but you don't see it real good because the machine they had back in those days, was what you would call a Stone Age machine. Today, the machine has become so sophisticated, and we can see, the image is real good. The image below is an example of what the image looks like today. So we can, if the bone is broken, we can see it real good. So normally we use radiation, X-ray, ionizing radiation to get images. And this makes it possible, you can see the inside of the body without opening the body, doing some surgery. There are other things I will talk about that we do in radiology. So at Montgomery, as a matter of fact, Lone Star College has two programs, one at Montgomery and one at Sci-Fair. It's a 2-year associate degree program. The program at Montgomery admits students to start the program in January, while the program at Sci-Fair admits students to start in August. You can apply to both programs. In fact, I advise you to apply to both programs because admission is very competitive. Normally, we get about 150 applicants, and we have room for 27 students. Same thing at Sci-Fair. Sci-Fair admits about 25 students. So once you get into the program, there are two aspects of the program. We teach you in the classroom, didactic education. We have, in fact, our lab at the college is equipped with the same X-ray machines that you'll be using at the hospital. So you practice with each other, and then we also send you to the hospitals. We have affiliated hospital and clinical education sites where you work with real patients. The first semester, we do not send you to the hospital. We want to give you the basic knowledge and everything you need to be able to work with patients at the hospital. So it's a combination of classroom work, lab exercise and simulation, and then clinical education at affiliated clinical sites. Now, the program is a competency-based program, which means you have to be competent. There are so many procedures that you practice and practice. You pose like a patient, and your classmates will be like the technologists, and you switch and practice before we can send you to the hospital to work with real patients. So you get basic knowledge, clinical skills, and then complete some required clinical competencies and outcomes before we send you to the hospital. Okay, next. So the program is accredited by the Joint Review Committee on Education in Radiologic Technology, JRCERT. This is the organization that, the U.S. Department of Education kind of gives the green light to accredit radiologic technology programs. If you are accredited, if your program is accredited by this organization, it means you are doing a wonderful job, and we have the highest accreditation, 8 years accreditation. So, and we have the data to prove it. These are the clinical sites where we send the students for clinical experience. You work with the technologists employed by the hospital, and there are several areas that you get experience while doing clinical rotation. You go to surgery. These are examples of just the basic surgeries we do. And normally we have all these machines that you use to guide the doctor, the surgeon to do surgery. We have it at campus, and you learn here on campus before we send you to work in surgery at the hospitals. So there are more sophisticated, procedures which we do, but these are just the basic X-rays that we take. Next. Now, our program, after you finish all the didactic and clinical education requirements, you have to take a board exam, just like every other health occupations. This board exam is administered by the American Registry of Radiologic Technology. It's a national board exam. Everyone that goes through Radiologic Technology program in US has to pass this exam. You get 3 chances to pass it. First chance, you don't pass it. Second chance, then after the third chance, you have to go back to school. But at Montgomery, we always make a 100% pass every year. There were some years that, we made a 99%, but in general, we make 100%, and we have the data to prove it. Once you graduate from our program, you are well prepared to take the national board exam. Next. Again, I talked about the ART exam. If you're going to work in Texas, Texas requires you to have a certificate and a license. You have to have a license to be able to work in Texas. And you don't take another exam. Once you pass the ART National Board exam, all that Texas Medical Board, Medical Radiologic Technology section, all they need is some money from you. You pay the application fee and show evidence that you passed the ART exam and you get licensed. There are some states that don't have licensure. The beauty of licensure is that those states that have licensure, the salary, the wages are higher. Like Oklahoma doesn't have a license. In fact, I went to school in Oklahoma, and you can work without a license in Oklahoma, and that is not good because the wages are pretty low when there is no licensure. Texas is one of the states that have a licensure. Next. So once you graduate, in fact, the job market is pretty good. The hospitals employ, the area hospitals employ our graduates. In fact, before graduation, most of our students, graduates, they have 1 or 2 jobs lined up. You can work in outpatient clinics, physician offices, advanced modalities. We have interventional radiology. We have a mammography. We have a health cap. Those areas, they train you, they cross-train you at the hospital. Or you can go back to school, get your BS degree or master's degree, and come back and teach. There are so many teaching positions opened up, and there is a research that shows that many educators are getting ready to retire, so there will be plenty of jobs opened up in the teaching area, in the teaching field. Or you can go into research. So many organizations use a CT and MR and regular radiology to do research. Or if you like to sell things, the companies that make all these X-ray machines can employ you. You become what we call an application specialist. You travel a lot. You can travel from state to state, from hospital to hospital, and also to foreign countries and showcase all these machines. And, they take care of your travel bills, your hotels, accommodation, everything. And you make pretty good money too as an application specialist. Next. So applying to our program, you must be good in science, biology. We have some physics in our program. But normally, you should be a graduate of a high school graduate, or you have a GED. If you have some college, basic or general education that you have to transfer, you have to do that early when the admission process opens up. But normally, you have to have a 2.0 GPA to be able to qualify to apply to our program. And then there are other tests we give, admission tests we call PSB, Health Occupations Aptitude Exam. That is like an ACT. It tests you about your math ability, English, reading, comprehension, and you have to pass. You don't have to pass, but there is no passing point or grade. There are 15 points possible. So the higher the points you make, the more you rank higher when we rank all the applicants. Next. So this is the scoring worksheet we use to evaluate students that apply for our program. We require biology. You have 2 choices. Either you have a biology 2404, or if you take biology 2401, then you have to take biology 2402, and we average your grades. And then whatever grade you make, A gets 4 points, B gets 3 points, C gets 2 points, and we multiply it by a factor of 4. For example, if you make A, you get 4 points, and 4 times 4 will give you 16. 16 points are possible. Well, I don't have time to go through all the scores and everything, but this is the scoring worksheet that we use. We require college algebra, English, psychology. Next slide. And there are bonus courses that, if you have time and you've taken the required courses, you can take some of these bonus courses to bring up your grades, your points, and that is an advantage. So we advise you to take those bonus points. Next. There are 66 points possible, but no one makes 66 points. Normally, we rank all the applicants and then go down the list and select 27 students. There is interview involved too. Normally, we invite about 40 students for interview, and then you score points during the interview. You write an essay also. So we add the essay points, the interview points to the scoring sheet points, and then we rank all the applicants. And from that list, we select 27 students. Next. So this year, the application process will open up in July 6th. And then the PSB test opens the same day, and you have till September 28th to take the PSB test. And then the deadline to submit everything is October 5th by 5 p.m. And then if you are admitted into the program, of course, you have to be invited for interview. So after the interview, around November, you get later whether you are admitted or not. And then we have orientation for those students admitted, but the program starts in January. We require you to do background check and drug tests and immunization, but you don't have to worry about that now until after admission. Now, many of our students, after the 2-year associate degree program, they reapply after they have passed the national board exam to do CT. CT program, we have it here at Montgomery, is a 1-semester program. And it will make a big difference if you add CT to your 2-year AAS degree. And then SciFair has the magnetic resonance imaging. The magnetic resonance imaging is a 3-semester program, but the CT is a 1-semester program. And there are so many jobs available in CT. In fact, all these urgent cares and emergency rooms scattered all over Houston, they call me almost every week, and want me to send our graduates, and I don't have anyone left to send because everyone has a job. So the job market is good, but money is not all there is to life. We work with patients, so we take care of the sick and the wounded. This profession, not just our profession, but healthcare profession it's a calling profession. You are called to help humanity, to help the sick and the wounded. So that should be your number one goal, that you're coming into health profession to help the sick and the wounded. Yes, you get paid and you get rewarded for working, but that should be your number one goal. Yeah. And another thing I'm gonna say is make sure that you select what you love to do. Yeah. So there are so many programs we're talking to you about today. Make sure that you actually go into what you love to do, because you don't want to wake up every day and you're dragging yourself to work. It's like that ad on TV. This guy wakes up at 2 a.m. and he's going to make donuts, and he's saying, no, it's time to make the donuts. It's time to make the. You don't want to drag yourself to work. Okay? Make sure you select exactly what you love to do. I had a chemistry professor that told us a story I will never forget. His friend had a PhD in chemistry, and he was the most miserable person going to work until he went back and did exactly what he loved to do, and he was very happy. So select what you want to do from all these courses we've described today, and you would never, never regret it going to work. This is my email address and our website. So if you need more information, feel free to call. And in fact, go to our website. There are more detailed information about our program. Thank you.
Perfect. Thank you so much, Dr. Oster, for all that information. Very much appreciated. Okay, so next we have Dr. Danny Kiner here with us to teach us about the unique biotechnology program we have here at Lone Star College-Montgomery. Dr. Kiner, thank you for joining us.
Hi, thanks for having me. I really appreciate it. And to get started, I'd like to echo what Dr. Azor said about finding a job that you love and a career that you love, because there are so many people who are miserable with what they do because they spend, and think about this, you are going to go to work doing something for a lot of hours and a lot of years of your life. So if you find something that you love enough, it'll feel like you never work a day in your life. And that's the most important thing. And I really enjoy listening to these presentations from my colleagues here in the health occupations, because one of the things that can drive career satisfaction is doing some kind of work that you find to be very important. And the presentations we just heard, how can you not think that's important? You're helping people and affecting their lives in the most profound ways imaginable. So that's wonderful. And I think biotechnology is similar. One thing that's different about biotechnology from the professions perhaps that you've heard so far is that it might be a little harder to picture in your mind what a biotechnologist is. You can probably picture what an X-ray technician is, a nurse is, and a paramedic, and so on. But one of the reasons why biotechnology is a little more challenging is because biotechnology covers such an enormously varied universe. And so I would like to dive into a little friendly rivalry. We did hear Dr. Pruitt, who mentioned that because she had her mute on and said that physical therapy was the third most satisfying career. I have to make sure that I give my plug for biotechnology, because Forbes magazine did a survey and found that biotechnology was the happiest career in the world. So that's another thing. So all of these careers, I'm having fun at her expense, but all of these careers are wonderful careers. Well, why is biotechnology one of the happiest? Thank you. I see you there. Why is biotechnology one of the happiest careers? Well, what it is to me and the people in the industry who I interact with regularly, one thing that we do in this industry is we work on some of the most important problems facing humanity. Now, there was a Nobel Prize winning nanotechnologist at Rice University named Richard Smalley. And if you Google a phrase called Smalley's Grand Challenges, he came up with, and what he did was actually, he went to speak. When you're a Nobel Prize winner, you're in demand. And he went all over the world to speak to audiences. And he would always finish his talks with a question. What do you think are the 10 most important challenges facing humanity in the next 50 years? And his audience would give him a number of answers, and he would compile those answers. And he came up with the top 10. Don't have time to go into the specifics of the grand challenges, but the top 10 list, and if you go look at it, you can see what those top 10 items are. Biotechnology touches on 9 out of 10 of those problems. So if what drives you in terms of passion is solving some of the most important problems they have in the world, that we all have in the world, this is a good career for you. One thing that's different about biotechnology compared to the other programs that we've heard about is with the programs we've heard about, you interact with people in the most intimate fashion, and you're going to have very immediate input that you are going to affect their lives in a profound way, and what wonderful satisfaction you can get from that. Well, biotechnology is not quite like that, typically at least. You don't work with patients directly, but what you do is you work on a number of different things that can impact people less directly, but you can impact it in a very, very large way. And let's talk, if we can go to the next slide. We're going to get to the specifics in a second, but because biotechnology is such a diverse and varied field, I don't want to talk about what a typical biotechnologist is, because there's no such thing as a typical biotechnologist. Instead, what I want to talk about is, why do people like biotechnology? Why do our students succeed, or what do they have in common? And what they have in common is that they love to solve problems, and they love to find solutions to those problems, gives workable answers. So we can go to the next slide. That would be great. And what I have here are some images. And if you could just start in the top left corner, I'm going to talk about a few of the areas that biotechnology covers. So that first picture on the top left is medicine. So there's biopharma is an enormous piece of biotechnology, forming cures for diseases, treatments for diseases, vaccines. We're in the middle of a pandemic right now, and we have a local company called VGXI that many of our students have go to work at after they finish with our program. And they are one of the many companies in the country right now that are working on the COVID-19 vaccine. And that's very, very exciting. In the next one to the right on the top row, that's DNA sequencing and DNA testing. You may have heard of the Human Genome Project. Well, the Human Genome Project was one of the great achievements of science in the 20th century, where we decoded the human genome and located most of the human genes, and that gives us the ability to read both the history book and the instruction book of the human body, and that's really powerful. And not only that, but DNA sequencing and related tests are diagnostic in nature. So one thing that biotechnologists do is they help diagnose diseases. And if you can get early diagnosis of diseases, you oftentimes have a much better chance of having a good prognosis for that disease. If we keep going to the right, next we have forensics. So many of you may watch some of these forensic shows on TV, and I've mentioned DNA testing already. We teach you how to do DNA testing, by the way, in the very first course in our program, our Intro to Biotech course. But DNA testing and other biotech-related forensics tools are a powerful way of solving crimes, both in terms of getting people guilty who have committed crimes and proving that people are innocent who have not committed crimes but maybe have been accused of crimes. Those are very powerful things. Next one to the right, many of you may be environmentally oriented. Many of our students are. And this is where we kind of diverge a little bit from the other programs that we've heard today, because even though we're grouped in with the health ocs, we're not just a health oc. As you might have noticed with the first few categories, a lot of what biotechnology does is clinical in nature, but a lot of what biotechnology does is other things too, like environmental in nature. So bioremediation is a field within biotechnology in which you use organisms to clean up environmental disasters, oil spills and that kind of thing that can plague our community, which indirectly can affect health, of course. Now, if you go down to the bottom row on the left, one thing that biotechnology does is produce sustainable products. So I know that a lot of people are very worried about all the plastic that we use and all of the non-biodegradable disposables that we use, and including health professions and many, many other walks of life. Well, one area of biotechnology is where biotechnologists are developing ways to produce substitutes that are biodegradable for the components of plastics and other components that we use in our daily lives that are much more environmentally friendly. And so that's if you're interested in sustainability, that's a big thing. The next one over is biofuels. We're a fossil fuel-driven civilization. We can only do what we do as a civilization because of fossil fuels, but fossil fuels have their downsides. They do pollute the environment. They involve drilling and things like that that can be environmentally stressful. Well, biofuels is an area in biotechnology where we grow our own fuels essentially, and without having the time to go into the details of that, essentially the biofuels that are produced by the biofuel industry have all of the properties of petrochemicals and petrofuels, so they can go into the same pipelines, they can be processed in the same refineries, and they do all that without the environmental stresses that petroleum has. Genetically modified organisms, yes, they have some controversy associated with them, but we have a world now that has 7.2 billion people, and every single one of those 7.2 billion people needs to have healthy food to eat. So GMOs, one of the pluses to them is that they can add nutrition. Malnutrition is all over the world, including in the United States, and that's where you don't get enough nutrients. Famine is all over the world. We're blessed in this country to not have to deal with famine nearly as much as some other places in the world. But both famine and malnutrition can be helped with GMOs. GMOs can lead to pest-resistant crops. They can lead to crops with enhanced nutritional value. They can be used to have crops that even can put drugs in it, and that can lead to some preventative health approaches to the world and so on. And then finally, the last little graphic there is food and water safety. We all, like I said, we have to have food. We have to have clean water, every one of those 7.2 billion people. And in the worst case scenarios, there could be either an accident, or if you really want to think about possibilities, a terrorist attack where our water supply or our food supply is impacted in a very, very negative way that could kill or make sick millions and millions of people. Well, there are people who monitor our water and our food and keep us safe on the largest scales. And some of these things that I'm talking about, as you can see, you're not going to interact with the individuals who you impact in a positive way. But what you can know in your mind is that you are having an impact on thousands or even millions or possibly billions of people with the work that you do. And that's what makes it so satisfying. Okay, if we can go to the next one. One last thing I'd like to mention, kind of a philosophy of our program. You know, obviously our program is very science oriented, and there's a wide range of options. You can come to our program and for 2 years, graduate and go straight into the world as a professional laboratory technician. You can move on. You can use our program as a stepping stone and continue your education. We have a very close relationship with MD Anderson and their School of Health Professions, for example. We've had students who have gone off to medical school. We've had students who have gone to graduate school and things like that. what that all has in common, regardless of the particular path you want to take, is that you have to learn how to be a scientist in order to do science. And we really believe strongly in that. And because of that, we provide research opportunities, authentic scientific research opportunities to our students. So you coming into Lone Star College, if you come to biotechnology, you can get engaged in an authentic scientific research project immediately, and you can, many of our students who have really taken it to the next level have gone on to present at national and regional conferences and things like that. I'll just mention quickly a couple highlights of the research we do, and we have 3 graphics here. The one on the left, we do a lot of work with algae. Algae can be involved in biofuels. Algae can be involved in developing drugs. Algae can be involved in bioremediation. Many of the things that we talked about in the last slide, algae can be a platform for. So we can talk more about that another time. The middle graphic there is something called a microbial fuel cell. We have one professor here who has done a lot of projects with microbial fuel cells. That's basically, and this is going to sound funny, using bacteria to produce electricity in a very environmentally supportive way. So we can talk about that another time if you have questions about that. And then the last thing I'd like to mention briefly, because it was just such an exciting opportunity for our students, is we had a 3-year, and we're hoping to continue this collaboration with NASA. And this is kind of ties into the algae thing I just talked about. But we had an algae culture that actually was launched by SpaceX to the International Space Station. The astronauts on the International Space Station, they monitored the results of our experiment, and the SpaceX actually brought the cargo back down. The algae, we call it space algae because it sounds so cool, and that's now here on our campus. It was cryopreserved, which is a fancy way of saying it was frozen, so they can in a way they can stay alive. And our hope is, if we can ever get through this COVID-19 pandemic, is to do some very serious research on the algae that spent some time in space. And you certainly have an opportunity if that's exciting to you. Come to Lone Star, come to biotechnology, and we'd love to have you be a part of that. So anyway, there's much more, but I know we're pressed for time. So what else? There's my contact information. The last thing I'll leave you with is that I think this audience is probably primarily students who are just getting started, and so if that's you, we have an AAS program. You could literally come in and start our Introduction to Biotech course, which, by the way, I call that our Try It On for Size course. Gives you a survey of biotechnology, lets you decide if it's for you or not before you move on to more advanced courses. And within 2 years, if you come full time, you could be a professional laboratory technician doing that. If you are not a beginning college student and you have some credits under your belt, we have the Advanced Technical Certificate. It'll get you to the same place. It'll just get you there faster. So there are some requirements for that. It does require you have a degree. It does require that you have 3 semesters of biology, including microbiology, and 2 semesters of chemistry. But anyway, there's my contact information. If you have questions, I'd be more than happy to answer them for you. And thank you very much for letting me participate in this wonderful event.
Perfect. Thank you so much, Danny. I am going to go right into the Q&A since we are short on time today. So I've got a couple questions in here. The first one, he mentions the BSN program, but I really think it's more targeted towards RN because he's asking about can you accept an F1 student who has completed prerequisites from another community college to the BSN program? But again, you have to have the RN before you can do the BSN. So I'm going to ask that question to you, Michelle.
Well, the only prerequisites that you have to get into the ADN program are you have to have English 1301, and you have to have A&P 1, and then you have to have taken your HESI. So if you have credits that those English and A&P 1 credits, those that will transfer over, then absolutely. And if you're wondering if they'll transfer over or not, you are more than welcome to talk to one of our counselors and to have your transcript submitted to the transcript department for evaluation. Absolutely.
Perfect. And we also have an international students department that can answer any questions you have about the specifics about being an F1 student. So if you go to our student services website, their contact information is on there. Okay, I also got a couple questions about the presentation. Maybe you missed the beginning or you missed the slide. Do not worry, we will be posting this presentation, a recording of this presentation on the open house website, the same one that you went to register for this session, the lonestar.edu/live. You'll be able to watch it back, screenshot any slides that you want and things like that. I also got a question about scholarships. And she says, I don't really know where to start. You are not alone. Everybody is in that position. Financial aid department would be a great resource for you to start. Most scholarships require that you complete a FAFSA before you sign up for any kind of scholarship. So make sure you do that. And then you said that you're a senior in high school, so make sure you talk to your college and career counselor as well. They'll be able to direct you to any kind of scholarship resources that are out there. I got a question for Danny. I think you might have covered this, but just in case there's anything you want to add. For biotechnology AAS degree, how would you go about starting and ending the degree? Is there anything you want to add on? You're muted. Oh, Danny, you're muted.
Is that better? Sorry about that. No, one thing that we have in common with the EMT program is that we don't have an application. So what we can do is we can work with you on an individual basis and set up a degree plan so that we can make sure that you are in the classes, both that you are eligible for in terms of completed prerequisites, and also that we work with you. We have students who go full-time, we have students who go part-time. So we want to talk to you individually about whether you're going to be working and that kind of thing. But the simple answer to that question is come talk to us and we'll work with you individually and get you started.
Perfect. And I have a question about PTA. Where can I get more information about the 40 observation hours?
So you can get more information. Oh, I put my video on. You can get more information about the 40 hours of observation during one of our information sessions. Basically, it is observing under a physical therapist or physical therapist assistant. You may do it if you work at the facility, but you must observe the professional you want to become, or contact any of our local community physical therapy clinics and ask to be an observation student. There is an observation form you need to fill out. So coming to one of our information sessions for specific instructions is helpful.
Okay. I have a question for Dr. Ozor. It says, what are the health implications of studying radiology? Rumors has it that women with kids are not safe to work in this field. You want to respond to that?
Well, that's the rumor that has been going on. Radiologic technology, we are protected. Normally, we are not in the same room where the patient is getting radiation. So if the patient is not able to hold still, normally the family members that came with the patient will go into that room to hold the patient for the exam. And if that happens, we have a lead apron made of lead. Lead absorbs X-ray. You know, it has a high atomic number that is good in absorbing X-ray. So we give that family member the lead apron to wear. So as a student, we are not allowed to hold patients. In fact, that's a no-no. It's one of our requirements, an accreditation requirement. So it's very safe. Plus, the energy level and the X-ray we use for diagnosis. In fact, I wish I had a table that compares the X-ray, the radiation you get from the environment, from environmental radiation, from cosmic radiation, from terrestrial radiation. So what you get from a regular chest X-ray, if you're a patient, is just a very minute amount of radiation. In the environment, it takes some days, several days to get the same amount of radiation. So our students are protected. We have a dosimeter that monitors the X-ray, the radiation you are exposed to. And every month we give that, we send that dosimeter to a company that will analyze it. And normally it comes back 0, 0, 0. It comes minimal, which means the student did not receive anything reasonable. But normally you are protected. And now I know why many people are worried about radiation level. You see, radiologic technology is not like working in a nuclear power plant. For example, Chernobyl power plant or Fukushima that exploded. If you work there and there's an accident, yes, you get a lot of radiation. But we don't deal with that kind of radiation. We don't deal with the material that give off alpha or gamma or beta radiation. We use electricity to generate X-ray. And we have formulas that we use to calculate how much X-ray, and everyone is protected.
Okay, perfect. All right. Sorry about that echo, guys. Okay, so in the interest of time, that's all the questions we're going to get to today. If you have more questions that you didn't get to ask or I didn't ask here, please email the folks here on this WebEx today. They are happy to assist you guys. So with that said, many people mentioned today that a lot of these programs have information sessions that will expand in way more than we touched on today. This is just the tip of the iceberg. So if you are interested in one of these programs, please go to their websites and check out those information sessions. All of their information is listed here. Maybe take a picture of this screen because you will probably want it later. And again, this presentation will be posted later, hopefully by the end of the week, and you can review it later or tell your friends about it. So I hope you